Thank you, Minister. Minister, you'll know that 1,500 children experienced a major congenital malformation or some form of neurodevelopmental delay because of exposure to Valproate. You, Minister, committed to an inquiry into this. That hasn't happened. I believe the terms of reference still have not been agreed. Support packages were to be put in place for victims as well and survivors. That hasn't happened. And I just want to get a sense from you, Minister, as to where things are at and how this can be advanced as quickly as possible.
Thank you, Deputy, for raising it. I'm very sympathetic to the patients, to their families and what's happened. I met with the patient groups involved in late 2020 and supported their call for a review into sodium valproate, and I committed to making it happen. So since then, senior officials in my department have been engaging closely with the patient groups and other stakeholders over the past year to finalise the terms of reference and to get this review underway. The review is going to be designed critically around giving a voice to patients and giving a voice to their families and looking at the use of sodium valproate in Ireland since it was first licensed. It was important that enough time and resources were invested to scoping out the work, what could be done, and critically engaging with the patient groups and not simply designing something and telling them what it, what it would be. There were a lot of factors to consider, and I wanted to make sure that the terms of reference incorporated what people wanted to see. There are a lot of different groups involved here. We have the manufacturer, prescribers, medicines and pharmacy regulators, most importantly, obviously, the patients themselves and their families. So as a result, there has been a lot of preparatory work to get this together and to make sure all of the groups involved would come together for the review. With regards to the community-based care, as part of the Valproate Response Project, the HSC has developed a diagnostic and a community pathway to ensure patients are properly assessed, that patients are referred to community services if they do receive a diagnosis of FVS. So the first step in developing the pathway was establishing a dedicated diagnostic clinic in 2019. That was established in CHI in Crumlin. It's headed by a specialist consultant geneticist, and as of today, 36 patients have received a diagnosis, and there's no waiting list at the moment critically for that diagnosis. And then I might, in my next response, continue on the rest of the community pathway.
Deputy.
Well, Minister, I think what people will want to hear is when will the terms of reference be complete? And when will the inquiry be established? Have you any time frame at all? Because that was a commitment that was given a long time ago. There was also a commitment given in 2019, and the HSE recommended medical cards for all individuals who have FVS, as you said yourself. That hasn't happened. I also understand it was recommended that CHOs should submit business cases for additional supports to provide these services. But according to the Medical Independent Report, none of these have been submitted. A national FVS coordinator was to be appointed. Has that person been appointed? And my understanding is to date, only 35 people have been diagnosed with FVS, and we know the number is going to be much higher than that. So there is a diagnostic pathway, but it clearly isn't working fast enough. So my questions again, Minister, are when will the inquiry be established, and when will the supports that were promised be put in place?
Thanks, Deputy. The inquiry will be established as soon as we get the terms of reference finalised. It's just important that the terms of reference are ones, first and foremost, that make sense for the patients and for the families and for the groups, but also that all of the stakeholders can work with. So we're just looking at those terms of reference in terms of the review at the moment. I can't give an exact date at the moment, but I will revert to the Deputy with an update when I have it. And with regards to the community care, so what's happening is after a diagnosis, the geneticist is making a recommendation on the health services that are needed for the patient. This is very important. So the geneticist is designing or recommending a package of care. The relevant CHO is then informed, and a liaison officer is appointed, which I think we'll all agree is important. Now, the liaison officer establishes the link to the services and critically is an advocate for the patient as well. And at that point, the appropriate healthcare services and the appropriate equipment are provided through the care pathway and with the CHO.
Minister, I met with the campaign group and I met with many families, and they say, and they're very sore about this, it has to be said, that nurses were sent to families to assess their support needs, but no supports ever came, and that's the problem. So what we have is a commitment to an inquiry which has still not been established. I hear what you're saying, that you want to get it right. They want it right as well, but they need some sort of time frame as to when this will happen. Solid commitments were given in relation to community care, as you've outlined. Nurses sat down with patients, with individuals, assessed their needs, and they simply haven't got them. Commitments and promises were made in terms of medical cards and a whole range of medical supports. And it's a really sore point for them that while they're still waiting for word on when the inquiry will be established, their healthcare needs haven't yet been met. So yes, it's great that nurses are engaging with these individuals, but if there's nothing coming out the other end of it, and the HSE are saying we haven't got the resources and there's a blame game going on, that doesn't suit anybody. So it just needs to be resolved, Minister.
Minister, to conclude.
Thanks, Deputy. Certainly, that's very serious if that's the case. It's not the advice I have from the Department or the HSE. The advice I have is that the services and the equipment are being provided. There is a mechanism whereby if a CHO doesn't have budget specifically for this group, it can put a business case together centrally. The HSE hasn't received any business cases, and the advice I have is that the CHOs are providing. But I tell you, what you're saying is serious, and I'll look into it today. And well, let's take a look, and I'll revert to the deputy with a note on same. Thank you.